Have you ever stopped to think about how artificial intelligence is transforming medicine? Imagine a future where diagnoses are made in the blink of an eye and treatments are personalized with millimeter precision. But does this revolution mean the end of human doctors? Get ready for a fascinating journey where we explore the impressive advances in AI in healthcare and the essential role that doctors still play. Stay with us and discover how technology and humanity can coexist in the search for better medical care. Artificial intelligence, or AI, refers to the ability of a machine or computing system to perform tasks that normally require human intelligence. This includes the ability to learn from experience, understand natural language, recognize patterns, and make decisions. In medicine, AI is used not only for data analysis, but also to help doctors with personalized diagnoses and treatments. AI uses advanced algorithms and machine learning to process large volumes of data, allowing it to learn from past cases and identify trends that might otherwise go unnoticed by human doctors. This technology is advancing rapidly with increasingly practical applications in clinical settings, offering the potential to transform not only the way we treat disease, but also the way we think about health and medical care. The history of artificial intelligence in medicine begins in the 1950s and 1960s, when the first AI systems were developed. One of the first programs was Mycin, created to diagnose bacterial infections and recommend treatments. Although it was just a prototype, Mycin demonstrated that computers could be used for complex medical decisions. The evolution of AI accelerated in the following decades, with the development of new technologies such as neural networks and machine learning algorithms. Today, AI is capable of analyzing medical images, predicting disease risks, optimizing treatment plans, and even assisting in minimally invasive surgeries. This evolution has not only expanded the capabilities of healthcare professionals, but also brought a new approach to medical education, allowing young doctors to be trained by data and real examples in a more diverse and efficient way. The initial impact of AI on medical diagnosis is remarkable. Many healthcare professionals have been reluctant to fully rely on machines for diagnoses, but recent studies have shown that AI can equal or even surpass doctors' accuracy in diagnosing various conditions. For example, AI systems have been used to detect cancer in imaging tests with an impressive rate of certainty, helping to reduce the margin of error and speed up the initiation of treatment. However, this impact is not just limited to accuracy. AI also helps doctors analyze a greater number of cases in less time. Automation and data analytics have transformed patient triage and identifying underlying conditions that might otherwise be overlooked. This efficiency undoubtedly reduces the workload on doctors, allowing them to focus on patients' emotional and psychological needs, which machines cannot yet fully meet. Success stories with AI in healthcare are inspiring and show the potential of this technology to transform medical practice. One of the most notable cases occurred with the use of AI algorithms in the early detection of eye diseases that can lead to blindness. A study in ophthalmology clinics demonstrated that AI could detect signs of diabetic retinopathy with similar accuracy to experienced specialists. Another example is the use of AI for skin cancer screening. Applications developed for analyzing images of skin lesions have helped dermatologists identify anomalies with a surprising accuracy rate. These examples not only illustrate the success of AI, but also highlight the importance of the collaborative role between technology and human experience. While AI can provide faster and more accurate diagnoses, human empathy, care, and understanding remain irreplaceable in medical practice, reaffirming that technology should be seen as an ally, not a replacement. Telemedicine is an innovative approach that has gained prominence in recent years, especially after the pandemic. With the help of artificial intelligence, this practice becomes even more efficient and accessible. Telemedicine allows doctors and patients to interact remotely, eliminating geographic and social barriers. AI contributes to this transformation by facilitating appointment scheduling, symptom screening, and diagnostic support. Applications that use AI can, for example, evaluate the symptoms reported by the patient and suggest the urgency of the consultation or a possible initial diagnosis. This virtual interaction, in addition to being practical, ensures that many people, especially those with mobility limitations or who live in remote areas, can receive adequate medical care. By using AI, telemedicine platforms can learn from each interaction, constantly improving care and recommendations for users. Thus, telemedicine is not just a modern trend, but a way to humanize healthcare, offering access to care that might otherwise be inaccessible to many people. Artificial intelligence-assisted diagnostic tools are becoming essential in contemporary medical practice. These systems use machine learning algorithms to analyze clinical data and medical images, offering assistance to healthcare professionals in identifying diseases and conditions. A clear example of this process is the analysis of imaging exams, such as X-rays and MRIs. AI systems are capable of detecting anomalies with accuracy that often surpasses human assessment. Furthermore, these tools are constantly fed by new data, allowing them to improve and adapt to new medical discoveries. This continuous evolution results in faster and more accurate diagnoses, reducing waiting times for patients and, consequently, speeding up the start of treatments. However, it is important to emphasize that the final decision on any diagnosis must always be made by a qualified doctor, who takes into account human and emotional aspects that artificial intelligence cannot yet reproduce. Remote patient monitoring is another area where artificial intelligence is transforming medical care. This practice involves the use of wearable devices or apps that collect real-time health data, such as heart rate, glucose levels, or sleep patterns. AI analyzes this data to identify any anomalies that could indicate a health problem. This is especially useful for patients with chronic illnesses such as diabetes or hypertension, as it allows doctors to monitor their condition continuously and intervene quickly if necessary. Through this active monitoring, doctors can prevent complications and improve patients' quality of life. Furthermore, the information generated helps personalize treatments, enabling real-time adjustments based on the specific needs of each patient. With this, the patient becomes an active part of their treatment, receiving guidance according to their real health conditions. Artificial intelligence is revolutionizing the way treatments are personalized in medicine. By analyzing large volumes of data, AI can identify patterns that can be crucial in choosing the ideal treatment for each patient. This is especially relevant in complex conditions such as cancer, where the response to different therapies can vary significantly between individuals. Through AI, doctors can gain insights into the effectiveness of specific medications, taking into account genetic characteristics and other individual factors. Additionally, AI systems can simulate a patient's response to different treatments before they are even administered, allowing more informed decisions to be made. This approach not only increases the chances of treatment success, but also minimizes unwanted side effects, as doctors can adjust therapies according to each patient's peculiarities. In short, the personalization promoted by AI marks a significant advance in healthcare, highlighting the importance of technology as an ally in medicine. The application of artificial intelligence, AI, in medicine raises important questions about ethics and data privacy. As technology advances and becomes an integral part of medical care, the handling of sensitive patient information needs to be approached with the utmost responsibility. Data such as medical history, test results, and personal information are collected and analyzed by AI systems to improve diagnoses and treatments. However, this collection requires a commitment to protecting individuals' privacy, as well as a clear understanding of how this information is being used. Respect for privacy is not just a legal issue, but an ethical issue that concerns the very concept of care and trust between patients and healthcare professionals. In many cases, patients may feel insecure knowing that their information is being shared or used by algorithms and machines, raising the question: how far does trust go in the healthcare system? It is essential that healthcare institutions and technology developers comply with strict legislation, such as the General Data Protection Law, LGPD, in Brazil, which establishes clear guidelines on the collection and use of personal data. This not only protects patients, but also helps build a relationship of trust between patients and technology, showing that AI can be a safe and effective ally in the search for health. Another significant challenge facing artificial intelligence in medicine is inequality in access to technology. While AI has demonstrated its value in many areas, its adoption is not uniform. Urban regions, where the health infrastructure is more robust, tend to quickly adopt these innovations, while rural or less favored areas face difficulties in accessibility. Furthermore, The implementation of AI tools may also depend on financial resources, which puts healthcare facilities that cannot afford these costs at a disadvantage. Consequently, patients in these regions may find themselves limited to lower quality medical care, perpetuating cycles of inequality and exclusion. For AI in medicine to fulfill its transformative potential, it is essential that strategies are developed to ensure that all patients, regardless of their place of residence or socioeconomic status, have access to more efficient diagnoses and treatments. This may involve partnerships between public and private sectors, a policy to encourage health technology in the neediest regions, and training professionals so that they can use AI to their advantage. Thus, inclusion will become a key part in the evolution of healthcare with the support of artificial intelligence. Technology inequality is not just a matter of geographic location, but also manifests itself in economic and social barriers. Young doctors and healthcare professionals in large cities have an easier time getting up to speed and learning about AI, while those in more remote areas may continue to use traditional methods due to a lack of infrastructure and access to training. This discrepancy in training and access to cutting-edge technologies can result in a huge difference in the quality of care provided. Additionally, patients who have limited access to information about AI in healthcare may not understand the benefits or how this technology works, creating mistrust and fear. Many prefer to consult traditional doctors who, although experienced, may not have technological support in their practices. To mitigate this problem, it is essential that there is greater dissemination of knowledge about artificial intelligence, not only among healthcare professionals but also among patients. Accessible educational campaigns and training programs must be established to inform and empower everyone involved, ensuring they can make the most of the innovations available in medicine. Equity in access to training and technology is vital for building a health system that benefits everyone, regardless of their situation. Although artificial intelligence has shown impressive advances in medical diagnoses, its limitations in complex diagnoses still deserve attention. There are situations where AI data analysis is not enough to fully understand the nuances of certain health conditions. Rare or multisystemic diseases, for example, can challenge algorithms and require deeper understanding that a machine may not have. Furthermore, AI typically operates based on previously available information, which means that if a condition has not been well documented or studied, its detection may fail. There may also be variations in the data that the AI uses, resulting in biases that can negatively influence the diagnosis. Healthcare professionals, therefore, need to be aware of these limitations and not blindly trust AI-generated analyses. The true strength of medical practice lies in the combination of technology and the human eye. Doctors can interpret information, perform physical examinations, and consider the patient's individual context, leading to a much more comprehensive and confident diagnosis. So, while AI can serve as a powerful tool, it should be used to support medical practice and not as a replacement. The interaction between human clinical decision-making and technological innovation proves to be the best approach to ensuring quality and reliable healthcare. Doctors, as healthcare protagonists, now have the opportunity to work alongside artificial intelligence, AI, to enhance their daily practices. Rather than seeing it as a threat, it is essential that healthcare professionals understand that AI is a tool that can speed up diagnoses, improve treatments, and facilitate decision-making. Collaboration between doctors and AI begins with the integration of systems that collect and analyze data efficiently. For example, when prescribing a treatment, a doctor can use AI algorithms to observe results from patients with similar conditions and thus personalize the approach for each individual. Additionally, AI can assist with triage, allowing doctors to focus their efforts on situations that require the most attention. It is a new work model where technology does not replace doctors, but rather complements them, allowing each person to play their role in a more effective and humanized way. With the advent of AI in medicine, the need for doctors to develop technological skills becomes timely. In an increasingly digital world where data analysis and machine intelligence are becoming commonplace, healthcare professionals must familiarize themselves with these tools. Continuing training courses in technology and AI for doctors are essential, as they not only offer knowledge on how to use systems effectively, but also an understanding of their limitations. Doctors who become proficient in technology will be able to integrate AI into their practices more safely and productively, ensuring they can trust the data it presents. This skill development is not limited to the use of programs and applications. It's also about cultivating a critical understanding of how AI impacts patient care and how it can be used to improve the user experience in the pursuit of health and well-being. While technology plays a growing role in medicine, the importance of empathy and human care has never been more crucial. AI can perform fast and accurate analyses, but it cannot replace the human touch, understanding, look, and active listening that a doctor provides. It is essential that healthcare professionals maintain and develop these interpersonal skills, as the emotional bond and trust established between doctor and patient are fundamental to effective treatment. Machines can program data, but human care is unique and irreplaceable. Healthcare professionals must learn to balance the use of technology with the need for care based on compassion and acceptance. A doctor who listens carefully and genuinely cares about your well-being is sure to make a significant difference in your life, ensuring not only effective treatments but also a richer, more rewarding care experience. Changes in the training of healthcare professionals are inevitable with the rise of AI. Educational institutions are being challenged to adapt their curricula to include technology knowledge in addition to traditional medical sciences. As a result, new doctors need not only a medical degree but also familiarity with AI and digital tools that are revolutionizing medical practice. The training of doctors of the future must incorporate classes on the use of AI for diagnoses, ethics in the use of technologies, and the interpretation of data and results that these systems provide. Furthermore, it is essential to teach new generations about the importance of interpersonal skills, ensuring that they are competent and understanding professionals. Thus, the training of health professionals will become more holistic, preparing them to be not only good doctors, but also better equipped to meet the needs of the contemporary world of health. In recent years, we have seen exponential growth in emerging trends in medical technology. Innovations in artificial intelligence are emerging as pioneers in this revolution, bringing significant changes to the way healthcare is administered. One of these innovations is telemedicine systems, which allow patients to receive guidance and medical care without leaving home. This modality not only facilitates access to healthcare, especially in remote regions, but also alleviates the burden on healthcare centers. Additionally, wearable devices such as smartwatches are becoming popular, monitoring vital parameters and sending real-time data to doctors. These devices help in the early detection of diseases, promoting proactive care. Another emerging trend is the use of care robotics in hospitals, which plays a fundamental role in performing repetitive tasks, helping professionals to focus on human interaction with patients. 3D printers, which can create personalized prosthetics and even tissues, complete this evolving scenario. Thus, the fusion of AI with these technologies represents a new era for medicine, where personalization and efficiency in treatments are prioritized and patients become more active in their own health. Startups are becoming a driver of innovation in healthcare, working intensely on developing solutions and technologies that employ artificial intelligence. With a focus on solving complex and specific problems, many of these small companies bring fresh and disruptive ideas that challenge the status quo of traditional medicine. An example of this is the use of applications that use AI to monitor patient health, allowing a more proactive and preventive approach, rather than reactive. Additionally, startups have collaborated with healthcare institutions to integrate AI systems into emergency rooms and outpatient services, improving patient triage and resource allocation. This wave of innovation is also attracting significant investment, highlighting growing confidence in these companies' ability to reshape healthcare. The role of startups in driving the evolution of treatment and diagnostics cannot be underestimated. They have the potential to transform healthcare into a more accessible, personalized, and efficient sphere for everyone, especially for women who seek quality and innovative care. The training of healthcare professionals in the digital era is changing radically, as new skills become essential. Universities and medical schools are integrating teaching about artificial intelligence and digital technologies into their curricula, preparing students for a future in which technology plays a vital role in patient care. It is critical that future doctors understand how AI tools work, not only to use these systems but also to properly interpret the data generated. Additionally, Professionals need to develop interpersonal and cultural skills as medicine becomes more patient-centered and interdisciplinary collaboration. Medicine is not just a matter of science. She is also deeply human. Maintaining this connection is essential, especially in a setting where technology can intimidate some patients. Thus, medical training becomes a vital combination of technology, empathy, and ethics, preparing professionals to act in a conscious and informed manner in the future of healthcare. Reflecting on what it means to be a doctor in the future is to confront deep and intriguing questions. The presence of artificial intelligence in medicine makes us rethink the traditional role of the doctor. Rather than just being a symptom detective, the doctor of the future will act as a collaborative leader who uses technology as a support rather than a substitute. This may include using AI systems to diagnose illnesses, but interpreting diagnoses and humanizing care will remain human responsibilities. Trust between patient and doctor becomes even more crucial, as patients expect not only technical knowledge, but also support and understanding during their health journeys. Furthermore, ethical decisions about the use of technologies and data privacy are challenges that doctors will need to face. Therefore, the ideal doctor of tomorrow will be one who knows how to balance medical experience with the capabilities of artificial intelligence, always seeking the best for his patients in a world in constant transformation. Artificial intelligence in medicine should not be seen as a replacement for human doctors, but rather as a powerful ally that can improve diagnoses, treatments, and patient care. The true strength of medicine lies in combining technology with empathy and human experience. Share with us which story you would like to hear next. What topics at the intersection of technology and healthcare do you find most interesting? How do you believe artificial intelligence can impact the relationship between doctors and patients? Do you trust that this technology can help humanize healthcare? Don't forget to subscribe to our channel and tune in for the next video, where we'll continue exploring the innovations that are shaping the future of healthcare.